Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Imagine this. Some kids get what seems like a simple cough or fever, but then they struggle for months afterwards. Fatigue, brain fog, other health issues lingering.
Yeah, that's long COVID. It's a tough reality.
And there's some new research out, quite striking really. It suggests unvaccinated children and teenagers had a risk of developing these long-term problems. Well, up to 20 times higher compared to kids who got their shots.
20 times. It's a huge difference. And that's exactly what this analysis we're digging into looked at, trying to understand how vaccination in young people actually affects their chances of getting long COVID.
Right. So not just if it protects, but how.
Exactly. The big question was, do the vaccines protect against long COVID itself, directly, or is it mainly by stopping the initial coronavirus infection from even happening?
Okay. And they needed some serious data to figure that out, I imagine.
Oh, definitely. We're talking about electronic health records from almost 400,000 children and adolescents right across the U.S.
Wow, 400,000.
Yeah, it's a massive data set. It comes from a big research initiative called Recover. And the findings, they're also published in a scientific journal, eClinical Medicine.
Recover,
Yeah.
okay. And they looked at specific time periods.
They did. They focused on two key times, mid-2021, which was, peak Delta variant time,
Right.
and then most of 2022, when Omicron was really widespread. Looking at both helped see if the vaccine's effect changed as the virus itself changed.
Makes sense. So for everyone listening, this deep dive is really about giving you a clearer picture. How do these vaccines impact long COVID risk in kids and teens? We'll want to cut through any confusing info you might have heard and really get to the why.
And the why is where it gets interesting. The researchers used a specific technique, something called mediation analysis.
Mediation analysis.
Yeah.
Okay, what does that involve?
Think of it like this.
Yeah.
You want to know how a dam prevents flooding downstream. Does the dam itself stop the water directly way down there, or does it mostly work by holding the water back at the source?
Okay. So that separates the different ways something might be having an effect.
Precisely. They wanted to see if the vaccine's protection against long COVID flowed mainly down one path, simply preventing the initial infection, or if there was another separate path, like a direct protective effect, even if you got infected.
Got it. So this more sophisticated analysis, what did it actually show? What were the headline results for vaccine effectiveness against long COVID?
Well, the findings were pretty significant, especially during that Delta period.
Okay.
For teenagers, the estimate was about 95% effectiveness at preventing long COVID.
95%. That's huge.
It really is. Basically, vaccinated teens were only about 1/20th as likely to develop long COVID compared to unvaccinated teens during that specific wave.
Wow. Okay, but Delta was different. We know Omicron behaved differently, was maybe less severe initially for some. What happened when they looked at the Omicron period for both the younger kids and the teens?
Right. So when Omicron variants were dominant in 2022, the protection level wasn't quite that high, but it was still definitely substantial.
Okay.
For the younger children, ages 5 to 11, the vaccine was estimated to be around 60% effective in preventing long COVID.
60%. Still pretty good.
Yeah, definitely meaningful protection. And for the teenagers during that same Omicron period, it was higher, about 75% effective.
75. Okay, so even with a variant like Omicron, vaccination was still making a considerable difference in preventing long COVID.
It was. But that brings us back to the how. We see it offered protection, but how was it doing it? Was it directly stopping long COVID from developing after infection, or was it mostly about stopping the infection itself?
That's the core question, right?
Yeah.
What did the mediation analysis say about that?
And this is where the answer came through really clearly. The study strongly indicated that the main way the vaccine protected against long COVID was simply by reducing the chances of getting infected with the coronavirus in the first place, dramatically reducing those chances.
So less about fighting long COVID directly if you did get infected.
Exactly. They didn't find much statistical evidence pointing towards a separate direct protective effect against long COVID if a breakthrough infection happened.
So let me just clarify this. If a vaccinated young person unfortunately still got COVID, their odds of then developing long COVID weren't necessarily much different from an unvaccinated young person who also got COVID.
That appears to be the main implication, yes. The data really points to the vaccine's power against long COVID in kids and teens, coming primarily from its effectiveness at preventing that initial illness from starting.
Hmm.
It lines up with what Dr. Young Chen, one of the senior scientists on this study, said. He put it quite plainly. Preventing COVID-19 infections in the first place, including through vaccination, appears to be the best way to avoid long COVID.
That quote really sums it up. Prevent the infection, prevent the long COVID. Okay, now with any research, especially looking at huge data sets like health records, there are always nuances, potential limitations. We need to talk about those too.
Absolutely. It's crucial for context. And there are a few points here. First, relying on electronic health records means, well, you only capture what's recorded.
Right.
So it's possible some infections, maybe milder ones, particularly in vaccinated kids, might not have resulted in a doctor visit or a test that got logged. They might be missing from the data.
Okay, so maybe some undocumented infections could slightly skew the numbers.
It's a possibility they acknowledge, yeah. Second, actually diagnosing long COVID, especially in children. It can be challenging. Symptoms can be varied, overlap with other things. While the researchers used a careful set of criteria based on symptoms recorded in the health records to identify likely long COVID cases, it's still not perfect. Different doctors might record things slightly differently, you know?
Sure, consistency can be tough with records like these. Any other limitations tied to how the study was set up?
Yes, a couple more. For the group of adolescents studied during the Omicron wave, some of them actually got their first vaccine dose later in that observation period. Ah, okay. So they weren't vaccinated for the whole Omicron wave being studied.
Some weren't, no. Which means the overall effectiveness estimate for that specific group might be slightly different than if everyone had been vaccinated from the start of that wave. It potentially affects how widely we can generalize that 75% figure.
I see. And anything else?
Just that they had to define a minimum follow-up time to see if long COVID developed. They had to draw a line somewhere. This might mean some cases that perhaps developed much, much later wouldn't have been captured in this particular analysis.
Okay, those are important details to keep in mind. Good to be aware of the caveats. But even with those points, the overall message feels quite consistent, doesn't it?
It really does. The main takeaway seems pretty robust. Vaccination was a key tool for preventing long COVID in young people. And the primary reason. It was good at preventing them from getting infected with the coronavirus to start with.
Yeah, and seeing that pattern hold up across different age groups, kids and teens, and across different major variants, Delta and Omicron, that adds weight to the conclusion. It definitely does. And that finding from the mediation analysis that the lack of strong evidence for a direct effect against long COVID once infected, that's a really crucial piece of the puzzle here.
Okay, so let's try and sort of crystallize this. We've looked at this big analysis, hundreds of thousands of health records.
Yeah.
It shows the vaccine, the BNT162b2 vaccine they studied, was effective in protecting children and adolescents from long COVID, especially protective during the Delta surge.
Correct. High effectiveness then.
But the way it offered this protection, the mechanism, seems to be overwhelmingly about preventing the initial coronavirus infection itself.
That's the core finding, yes.
Not so much acting as a separate shield against long COVID if you did happen to get infected.
The analysis points strongly in that direction. Prevent the infection, prevent the long COVID risks.
Which really underlines why vaccination campaigns were pushed as such a vital public health strategy, doesn't it? Particularly thinking about protecting younger people from these potential, long-lasting effects of an infection.
Absolutely. It reinforces that preventative approach. And, it also makes you think about what's next.
How so?
Well, we're still figuring out the exact mechanisms behind why long COVID happens, right? The biology is complex.
Still a lot of unknowns there.
Exactly. So how can future research build on this? If vaccination primarily works by preventing infection, are there ways to identify maybe specific groups of kids or teens who might still be at a higher risk of long COVID, even if they get infected after being vaccinated?
Yeah. Are there other underlying factors?
Could be. And as we learn more about what causes long COVID at a biological level, maybe more targeted prevention strategies could emerge, or even treatments for those who do develop it.
So this study gives us a really clear answer on the vaccine's main protective route, but it also highlights that the story isn't over. There's still more to understand about long COVID itself.
Precisely. It's a valuable piece of evidence, clarifies the role of this vaccine, but yeah, the research journey continues.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.